Well, Mark, since you retired football, you have kept yourself busy with a new initiative that you've started up called Walking is Brilliant. And I absolutely love this, really keen to tell people about it. But I want to start by explaining how it came about, why you started it.
It started off, I came out of work on the 2nd of July. I'd been involved in football for 33 years and never had a break. I'd never been out the game, and it became very regimental. So although I've never been in the army, I try to compare it to being told what to do, when to be there, what time to be there, what to eat, what time you got to go to bed, who we're playing Saturday, when we're traveling, all these little things. And it trains the brain, and it becomes routine. And when I came out the game on the 2nd of January, I got relieved of my job at Chesterfield. Myself and the manager, John Sheridan, we left the club. I haven't been back in the game since, but because it was during the middle of the season, the first couple of days was strange, to say the least, because I even got up to put my kit on and go and get in the car. I was that bad, and mentally I went into space. I became a space cadet. 33 years without being involved in football. So I thought, what am I going to do? I obviously need routine. At the same time, my dad got diagnosed with cancer. So me and my dad and it's nothing compared to a lot of people. And this is the thing that I've tried to understand about mental health in people, is that everybody's affected differently, whether it be anxiety, depression, and the research that we've done over the last year is that, I mean, the stats that came out, some stats I read, 1 in 4 people suffer from mental health at some stage in their life. It's wrong. It's 3 in 4, because the people that I speak to now, I mean, my Twitter is open to direct message. If I showed you some of the messages and some of the stories, you wouldn't believe. So I tried for help. I got help. The PFA gave me help. I went to see a counsellor, and she helped a lot. And then I decided to go to some of the players that had been quite open with their mental health struggles since coming out of football. We've become a close-knit group. So we've got Steve Howie, Chris Kirkland, and they won't mind me saying their names either, Dean Windass, Nigel Jemson, Chris Brown, ex-Doncaster, myself, and John Parkin. Now, we've formed a group. We decided we wanted to form a charity, which we're still waiting for a charity number, but we're on the way. But we're a non-profitable organisation at the moment. Walking's Brilliant. We called Watch, which is called Walking, which stands for Walking and Talking Charity Hikes. So our intention was to climb Kilimanjaro this year for mental health and the NHS. The mental health side of the NHS have a relative that works on the mental health side in the NHS, and they've been overwhelmed during COVID. So this started before COVID, and then when COVID happened, obviously it escalated tenfold. So we just thought, us guys being in the public eye, people look up to you because you're in the public eye, and if we can be open about our struggles, then people will gain confidence from that, and then they might be open about their struggles. And the results that we've had from it, we're not professionals. We can't tell people what to do. We can tell them to go and seek help, but we can also say to them, this is what helps us. And that's how we've reached out. The amount of funds that we're raising and that we're going to distribute have blown us away. We're doing a walk from coast to coast in July. We're going to go to Kilimanjaro next year now because of COVID. We couldn't go this year. So we've got big plans moving forward, because mental health's never going to go away. And it's our way of saying thank you for being supported and to give a little bit back. And we're really, really enjoying helping people, basically.